pleasure today to be in front of such a large audience, and especially an audience of people that care about how we use technology to help people, not just about making more technology. So it's a pleasure for me to get to spend some time with you guys, and I know I'm between you and lunch. So what I'm going to do is we're going to move through this fast, but I'm going to touch on my 3 major points, and we're going to dive in. So got way far ahead, so you guys are actually going to get this Quentin Tarantino style. Just kidding. All right, so about 3 weeks ago, I was walking through Denver International Airport, where I recently moved out to Denver, and I was just flying, you know, doing the consultant thing, thinking about what the next thing that I had to do. And all of a sudden, I get a phone call from an acquaintance. This is not someone I normally talk to. In fact, I'm only connected to this person through one person. And so when I answered the phone, and the first words out of her mouth were, "Are you sitting down?" I froze. My eyes started to dilate, my heart started racing, and it gave me a physiological reaction. Now, I didn't react like that because then I thought that where was I physically located in space, you know, sitting is the new sick or something like that. But instead I thought, I need to brace myself because I'm about to be told something that could really, really be bad or good. Now, this is a great example of implicature, which is something from pragmatics, where it talks about the words that are actually written, the meaning is behind them, not in the syntactical value of those words. And so in healthcare, one of the most important things is when we are sitting and we're talking with patients, talking with your patients, talking with your healthcare practitioners, is that what we're told at face value, we actually need to dive in deeper and understand the true meaning behind it. And that's what implicature is. And so it's interesting that we've spoken to tools for years. I mean, think about how many cave people back in the day were talking their tool, please work, please work. But now we're actually speaking with tools for the first time, you know, in human history. And for Worrell, we've gone from designing products like we did in 1976 when medical devices became regulated, to in the 90s and thousands designing experiences, to now designing personas. Personas that have conversations with you. People are actually engaging with those brands. And I think this is one of the most exciting times in healthcare because of that. So my 3 goals for today. First, I want to talk about how consumer expectations are just being disrupted, just absolutely being crushed, how and why that is. And healthcare is late to the game, per usual. We were behind on mobile and we're behind on voice right now, so we need to change that. Secondly, I'm going to talk about how you can build engaging voice interactions. And you're going to be amazed because you've been doing it for quite some time. You just didn't know it. I'm going to talk about our process and some principles that we apply that we've learned from linguistics. And then finally, I'm going to share with you 2 experiments that we've run, one with diabetes and one with arthritis, to see how voice interfaces could be used to actually help people with their symptoms and actually deliver drugs in a proper way. Now, I believe that voice is going to help improve healthcare because it's going to make it easier for people to be healthy. That's kind of the fundamental expectation here. But consumer expectations are being completely disrupted. If you take a look, we've got this rapidly expanding AI-rich infrastructure, and it's in people's homes, which is just a crazy fact. This was before Q4 sales numbers, and these were being pumped out like no one's ever believed. And so if we even assume that 30 million devices are out in circulation, and we take probably a bad assumption that each family or each household only buys 1 device, that means that these are in 1 in 5 households in the United States. What does that mean? It's a Trojan horse opportunity to improve health. Why is that? Because it costs nothing for the user to purchase further than that, and they're able to use these things and interact with them throughout their entire day. So not only is the smart speaker itself a Trojan horse for us to engage and help people improve health, it's actually being wrapped around them in their everyday. And I'm sure you walk the floors. I mean, I even looked at the monorail, and it was covered in Hey Google. That's how this is really wrapping around people's lives. But there's a huge opportunity for healthcare. For me, maybe the most important thing Amazon and Google have done in the past 5 years is democratizing, making accessible machine learning techniques. One exists in the form of Alexa Skills Kit, the other in Dialogflow. And what this does is it makes it easy for people to be able to program into these different devices. And all we really need is an internet connection, a speaker, and a microphone. Now, just about a year ago, there was only 5,000 skills on the Alexa store in particular. I'm going to talk about that one. And out of those 5,000, the usage rate to continue to use that system is actually around 3%. So when you enable a skill, you're much less likely to continue to use it as compared to mobile, which is more around 13% engagement. And then when I looked at these numbers, I couldn't believe that as of yesterday, there was only 744 skills on health and fitness. This is just insane. So we've got the infrastructure, but why are people using this in the first place? What is it about being able to talk to a machine that people are so enthralled with? Well, I believe it's a couple things. The first is speed. It's just simply faster to be able to talk to a device for certain things, as opposed to having to click through a graphic user interface to get there. Secondly, it's much simpler. We've been speaking for over 150,000 years. And in fact, it's the first thing that we learn alongside walking, so it's much easier than navigating through a graphic interface, as we'll show you in a little bit. And then finally, it's simply more intelligent than, raise your hand if you've heard of IVRs. Interactive voice response. You all know them. It's when you call your bank and you get so frustrated you just want to talk to a human. It's so frustrating. I worked in a call center for 5 years in high school for Foot Locker, and I had to deal with people that were just exhausted from dealing with these terrible voice systems. It's given us a class of people that are apathetic for voice as user input, in my opinion. But it starts with recognizing what the users say. Speech recognition is now above human parity, so computers are now better at understanding the syntactical value of words. IBM says the word error rate is like 5.1%. Well, Google and IBM have actually beaten that. The second step is really where the AI comes in, and that's where context comes in. That's where the real meaning behind language is found in natural language understanding. And then finally, this is kind of the world of the conversation designer, is generating context-sensitive responses. This is what makes C3PO different from talking to your bank, as well as humor. And finally, what does that get us to? It gets us to cooperative human-machine interactions unlike we've ever had before. And so that is really why I'm super excited about this. Now, I realize chatbots are quite interesting too. Raise your hand if you've ever played with Smarter Child back on AOL Instant Messenger. Does anyone remember that? Okay, a couple of you. It was just kind of a fun bot you could talk back and forth with. So chatbots are interesting, but I'm not going to talk about those today. I'm going to keep it focused on voice. There's a couple different use cases right now going on in voice in healthcare. I almost wanted to drink water like Trump in that one, tipping it up and down 12 times. But there's three main use cases or reasons that you would want to use voice, and then there's two bad ones. So the good stuff is finding specific information and being able to record that. So an example is a food diary. I'll show that in a second. Secondly is accessing spoken guidance instructions. So whether it's getting a recipe that you're told how to make it as you're making it, because you want to be hands-free and eyes-free from the recipe book. My favorite is the guided meditation, because oftentimes with me being so ADHD, it's hardest to focus. But I'll turn on Alexa, and it'll help calm me and actually talk me through that stuff. And then finally, the performing a task. Top right, this is actually the highest rated skill on the Alexa store right now for health and fitness. It's called Ask My Buddy. And when I was looking through the reviews of Ask My Buddy, one of the reviews was a 40-year-old guy that commented and said, my kids love to play games on this. I enabled Ask My Buddy just because it sounded like a good idea. And then 2 weeks ago, I had a heart attack. And I was in so much pain that I couldn't get to my phone. It's the whole life alert thing for voice. And I was able to say, Alexa, tell Ask My Buddy to alert my family. The same device that his kids play games on is the same device that saved his life, is the same device that leads him through his 5-minute workouts every day. What an amazing opportunity for healthcare, and yet we're not taking advantage of it yet. Two bad examples of use cases, trend data. So all you have to do is ask your Alexa or your Google Assistant, tell me about the weather for this week, and halfway through a conversation, you'll be like, stop, 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 because it's too much information. We don't like to browse, and we don't like to see trend data on voice interfaces. Those are better for GUIs. And then here's one example. I love Vega All-in-One pea protein shakes. And so it would usually take me about 24 taps and 1:30 to record that in my MyFitnessPal. Now, if MyFitnessPal or Under Armour's in the audience, please build a voice app. This would make it so much easier for me to be healthy. All right, so I'm going to quick talk about our approach. Our goal is that we're just obsessed with fine-tuning what I believe is one of the best product development processes in healthcare. We work across drug delivery, we work across implantable devices, all sorts of stuff. But the goal here is kind of following something similar to biodesign, which I'm sure all of you are familiar with. We started applying voice across 3 fronts. One was in ethnographic research studies. And those were really interesting because this is the ultimate device to be a fly on the wall. Without having to fly expensive researchers to go meet with patients in their homes, we can live there. And we can capture longitudinal data and interactions based on that. But we didn't want to stop there. We thought, what if we could use this in our human factors practice? What if we could use this to help guide really complicated healthcare activities by speaking to the users themselves? And then finally, what we were realizing, getting these into patients' homes, seeing them react with Google Assistant and Alexa in particular, was that this is a tremendous tool for therapeutics. So people actually interacting with it has a cathartic effect that relaxes them and makes them pretty happy. I'm going to fly through this one, but use case definition, when you're defining your use case, so when you're actually building a voice app, define something that's simple, quick, and intuitive. Not too much complexity. There'll be time to add on complexity in other responses if you build it for a simple use case. And then for the persona, I've heard a lot of marketers tell me, oh, we don't need a persona in our voice app. Completely wrong. It's actually, one quick tip for this to hack it is go meet with your call center people or your diabetes coaches and literally just record weeks and weeks of them interviewing. Build it off of your best customer service people. And the reason is because if you don't give it a persona, your users will. They absolutely will. And then conversation design. So conversation design, that's where I'm going to stop on this slide, is, just on this slide in particular, is a carefully curated back and forth between humans and machines. And I've been playing around with a lot of different skills, a lot of different actions that they're not cooperative. And what do I mean by not cooperative? The cooperative principle is the foundation of pragmatics, which is a study in linguistics that takes semantics, which is just words at face value, and it gives them context, right? So this is the study of putting context behind words. And the cooperative principle gives you 4 rules or maxims. This is by Paul Grice, a philosopher. One is quantity, so say just enough, but no more. That wasn't showing up there, but an example of this, saying too little, is when you ask Alexa something and or Siri is a better example. You ask Siri something and she just goes, no. Give me more info. And the opposite of that is when it's just rambling on and telling you something, or one fun trick you can try on your friends is unconscious bias. So the term male nurse, is that too much information? Couldn't you have just told me nurse? Or lady doctor? You really needed to assert a gender to that person? You can dig into unconscious bias with this, and it's really fascinating to remove that from your app. The only other one I'm going to talk about is relevance, and this is often called the master principle of linguistics, because this is where you make your experience context sensitive, and this is where the AI can really get to understand where that person is at in their healthcare journey, and we can talk more about these after the presentation. All right, so getting into some of the experiments that we've run, this is the really fun part. This is the part that I care about the most, is actually getting this into people's hands in their homes. We applied this process and these principles on 2 different studies. The first one was for arthritis, and the second one was for diabetes. So arthritis, this one hits really, really close to home, for me in particular, because my mother has rheumatoid arthritis. And for a year, she was paying for Amgen's super expensive drug, Enbrel. And she was injecting it wrong. So she was following the process of sticking herself with a needle. She was following it to the T, or so she thought, but the drug wasn't getting there and her symptoms were getting worse. So she spent all that money for nothing. And this is what pharmaceutical companies are obsessed with, is getting beyond the pill and improving patient adherence. Well, what better way to adhere a patient or to know if they're complying with their regimen than if you're telling them how to do it every time? So, here's a quick example of one of our user experience designers, Liz. I can just tell you essentially what she's saying. She's interacting with Alexa, and it's guiding her through a self-injection with a pre-filled syringe. We were able to get this into 16 different patients' homes, and we were able to go there and compare what does a written instructions for use look like versus, that's the control, using Alexa to help guide you through the injection, and then using the instructions for use as a guide. Now, in human factors, it's really important to test training decay. And that means when you teach someone something, come back around and test them again to see if they were able to recall and remember that information. And what's interesting with this study was the initial setup took a lot longer with Alexa because they had to go through every step, telling them to make sure the site was clean, telling them to make sure that it was prepared for the injection. So it took them longer, but what ended up happening, as you can see, was their time to complete was almost the same. And yet there was almost 4 times as many use errors in the written IFU group. Well, no one reads written IFUs to begin with, because by the time that legal and regulatory are done with it, not to bash you guys have an important job to do, but it loses context because it's pure semantics, pure logic, right? 4 times the total use errors on both days, and the group that failed more was more confident that they did it right. Behavioral economics to a T. Just like in these gambling casinos, people become less risk averse as they lose more. So same thing here. The significance here, though, and that behind this study is that, well, one, retention. Voice helped them retain the information better when they were doing the injection after that. The second main thing is, have you ever heard the term elderly adopters? Well, it's this new thing with voice that has reconnected the way the adoption curve works. And what we found is that elderly people interact with voice interfaces, at least in a couple small studies, better than young people. Because the young people are so sick of having to talk to stuff that doesn't work, whereas old people just know to be able to interact with that thing much more naturally. I'll quick mention the diabetes study as well, and this was really interesting because it was our first attempt at trying to help reduce symptoms by using voice to interact with diabetes patients. And so our main objective, again, was to use it to help manage symptoms, but also to gather patient insights, so using it as a research tool as well. And we had 16 patients, formative usability study numbers, so that we can talk to the FDA and the AAMI, which is the lobby group for human factors, about this stuff. And the outcomes showed us kind of some best practices, and we got to learn a bunch from it, so that was good. The first one is heart to heart. So we would do a role play with Alexa, where Alexa would hear what you were saying, and would then act as if it was a friend that had just gotten diagnosed with diabetes. So Alexa, in this next example, I don't think we've got audio. No, probably not. But we actually had Alexa speaking in here with Kelly, who is 15 years old. And what happened was that she was actually able to share a really personal story with Alexa and found it pretty cathartic as well and relaxing. However, we had a lot of deals with intonation. Programming intonation, programming humor, very difficult things to do to be able to have a great cooperative conversation. And so that was, we learned a lot from that, because if you heard this, it goes, okay, thanks, gosh! And she just screams. It's like, don't scream, Alexa. Then we did a daily wellness survey. So these patients, like I said, had this for a long time. They had these devices for 2 weeks. They got to keep them at the end. And this is the health assessment focused on lifestyle, food, stuff like that. Main thing you need to get from this slide is that users felt like they were, responsible to report to Alexa. Sort of like with your personal trainers that I'm sure many of you have, being in this room. You kind of feel like you owe that personal trainer something, and that you should do it because that's your personal trainer. They felt responsible to Alexa. And finally, my story. So for this one, because you only have an 8-second response window with Alexa and 15-second response window with Google Assistant, we actually had to use the messaging feature, because that would give us 90 seconds of information from the patients as they're talking to the device. They felt very comfortable sharing their story, but there were constraints on timing for sure, and that was very, very frustrating. So in closure, there's really 3 main things I want you guys to take home, and that is your consumers, and it's probably in your homes as well, are being completely disrupted. This voice interface is changing everything yet again, and it's only going to change further as voice becomes the most desired input for augmented reality. Because augmented reality, the way you control your headset or whatever you're looking through is gesture, gaze, and voice. So we chose to get smart on voice for now, and then we'll move into gesture and gaze as a design firm. Second thing is it's going to force us to have the most user-obsessed, patient-centric design process of all time, because otherwise they're not going to use your voice skills unless you build your process around them and have cooperative conversations with those individuals. And finally, these voice interfaces are going to have great emotional and therapeutic benefits, and as more people like Arshia, who spoke this morning, start to get involved, we'll figure out how to elicit those types of things and how to improve mental health as well as physical health. And in closing, the title of this was called Your Bot Will Run Your Health. That's not going to happen. That's not going to happen. It's going to be collaborative. Human intelligence and artificial intelligence is always best when paired together. It's always going to be physical people, healthcare consultants working together with technology to be able to offset it, and that's absolutely what I'm standing behind. So thank you guys so much for your time, and sorry for being in the way of your lunch.